All right, ma'am, that was a lot of words of praises, and I will make sure that I do justice to all your expectations and justice to everyone's time here. Collectively, we are a very experienced group, and I'm really looking forward to learning at the same time as I share what I have learned about patient complaints. So my focus is going to be more on receiving complaints. So uh, first of all, let me know if you hear a lot of background sound behind me. Is it?
Yes, yes,
There's a temple right next to me, and let me know if
yes.
I should remove my earphones and try it. Will
You can
that
try.
work?
Yes, there's a lot of noise in your background.
Is this better?
I think yes.
Okay, cool. So I'll do without this. I'm really sorry. This should. I mean, they will be done with their RT in another 3 to 4 minutes, and after that, we'll be quiet. So
Fine.
till then,
Fine.
please bear with me.
Yeah.
Yeah. So my focus is mostly on receiving complaints when the complaint is actually being made by the patient, and what should we do before, during, and after that. So more from the point of view of because what happens is whatever we learn about complaint handling, it's all theory unless we know what should be done in the moment, the moment of truth as we call it. When that happens, what should we do? One, two, three practical steps, four practical steps that we should keep in mind when this happens. So I'll start with research. Ma'am, would you please make me the host? So
Sure.
I'll be able to share the screen.
Yeah. So I have.
Yeah, so I'll start with a research study. There are millions of research studies out there which say that whenever there's a lack of complaint, I mean, whenever there's a break in communication, whenever there's miscommunication, patient complaints arise mostly out of that. About 80% of our complaints arise out of that. What is interesting to know is that there is a gap between the understanding or kind of trust or expectation gaps between the public and the doctors, or if I have to say, and the hospital. So the public and the hospital, the expectation gaps are huge. When the study was conducted by R.D. Frail, and what he found was, so there were a similar set of questions given to both sets of participants, the public, general public, and the physicians in the hospital, and they found that the both of them agreed that the patients, I mean, the physician should be proactive in asking if everything is going okay, is there a complaint that they would like to register, and both of them agreed that openness about this particular subject, complaint, is not there, is not common, and people kind of try to skip that. They try to move to more nicer things as a part of discussion instead of talking about the problem or complaints per se. And patients also felt that they had been wronged. And when they complained, they were at a loss. They were at a kind of somebody who was, first of all, done wronged with. I mean, first of all, I had been cheated, if I have to say that way. And then nobody's here listening to me. So there was a long gap, and that also affected the expectation on the outcomes of complaints. So if I complain and you don't give me attention, I know that even if you give me the most, I mean, even if you do a most unbiased decision, if you come up with the most unbiased decision after my complaint, I would still have kind of doubts that you probably were biased towards the your staff and not towards me. So that kind of output came as a part of the study, and which was really interesting and kind of speaks a lot about. This was done in Germany, but I still feel this is so relevant even for our population and the way we behave, not just in hospitals and not just in healthcare system, but everywhere, every industry. So this is something that caught my eye, and I thought I will start my presentation with this. Any comments on this? Anything relevant? You feel this is not relevant? Any comments from anyone before I start the topic per se? If there are any comments, please put them in the chat box. Even if they arise later in the presentation, if something clicks later in the presentation, please put them in the chat box. So I'll move on to the topic. So let me start with a story of a hospital which was a huge corporate hospital, and they were doing a lot of marketing. And this is a true story. So they were doing a lot of marketing, and they were really spending huge money on marketing and stuff. Okay, so what happened was this patient called Anita. She was I will not get into the details. She was advised admission by the doctor, and she resided in the area where the hospital was, and she had seen the ad, and she was really interested. She was really intrigued by seeing the pictures and by hearing, I mean, listening to or reading the testimonials by the patients of the experience in the hospital. So she had very high hopes. When this happened, she requested the doctor to refer her to that particular hospital. She before on the day of before the day of appointment, but she was told that if you come by 8 o'clock in the morning, we'll be able to free you by evening. So it was a daycare procedure, some tests and some minor procedures to be done. So that's what she was promised. So she reached at 8 a.m. and she had to wait till 1 p.m. for the room to be allotted. 1 p.m. when the room was allotted to her, she expected that probably the test would start soon and she would be able to leave by late evening, but that's fine. She was she was understanding, seeing all the patients flow coming in and people being busy. So she was very patient on that. So she waited in the room, and a nurse came in and she said, "I'll be with you in a moment." And then she left. 5 minutes passed, 10 minutes passed. This lady kept her patience. 10 minutes, 15 minutes, close to an hour passed. Then she thought maybe that lady has forgotten that I'm here. She pressed the call button. That lady came in and she was really in a moment. And then she went back. So Anita felt she felt so hurt. She didn't even utter a word before this came onto her. Okay. So after that, the procedures were done. She was freed. She went home. She was relieved that the diagnosis was negative and she was not suffering from anything very life-threatening. So she was relieved of that. Whoever she called from her home, family, friends, doctor, anyone, whoever she called and told about her diagnosis, she made sure that she mentioned about her experience. And all of them agreed that they would never visit that hospital ever unless it's like there's no other option. So that kind of damage was done to a hospital only by that one moment of patience that lady did not have. And she did not know how to manage. And second problem was that nobody asked for her feedback when she was in the hospital. So two breaks, kind of two opportunities lost to maybe win this patient for life, but lost was lost. I mean, it was not just one patient, there were probably 10 other opportunities gone. So this happens every day. And I'd invite anyone to share a similar story or an opposite story or something that you have experienced as a patient, you have seen as a doctor, as a healthcare provider. Please share that. I'll stop sharing my screen for a while so I could hear and I could see you also. All right, so please tell me if there are any stories. I love listening to stories, and I really hope this would have happened in a physical session, and I would have been with you in a single room where we would have done icebreakers and we would have done more activities. But I'm sorry, this has to be done through a screen. But that's how most of the world is now. So we'll all have to bear with it. So please tell me if there are any stories. I'd like to invite you all.
Sharing, Beauty?
Yeah.
Can you stop sharing the screen?
Sure.
So that we all can,
Yeah.
Could you repeat your question once again?
So
once
I
again,
asked.
Let Reena join. She's joining in. So maybe let her also listen to the question. So meanwhile, maybe we all can recollect any incident that you came across where the damage was done just because the patient's complaints were not addressed or the feedback was not taken. Anybody who would like to share the experience? Dr. Pai, can you recollect of anything?
Yeah, lot of them, like, most of them are lack of communication, which you have been telling, and lack of patience also, I would tell you. People, they want to maybe just say their feeling to somebody who is, who is a responsible administrator, who has some maturity to take some decision, and also authority.
Any incident can you, because if you will talk
Ah.
about one incident, then probably
Okay.
we'll learn quickly where we failed to communicate. I completely agree with
Okay.
you that
Yeah.
we usually lose an opportunity to address it in the right way. But can somebody, either Dr. Pai or anybody, whoever can recollect any, at least
Just a
one
minute.
incident from the
Just
part? Yeah,
Yeah, good evening, ma'am. This is Dr. Balamurugan.
sure. Please.
Yeah, so today only we have received one complaint, like through online Google review
Mm-hmm.
for hospital. The one of the thing is that, as Sir said, the important communication mistake happened is the patient is going to, not the patient, the customer is going to foreign for his job. So he has to take the RT-PCR test.
Mm.
So what has happened? Within 48 hours, they have to take the sample, and they want to mention the sample collection date as yesterday, because their flight is today. Okay, so they mentioned that the point, and second, they want the passport number in the RT-PCR report. Okay, so in that commission, they have informed the front office executive, but they didn't inform to the lab.
Oh.
Like, so what happened is that in the finally, so they inquired about, they got the report, but without the passport number.
Mm.
So it's a pretty issue in the immigration and the airport.
Oh my
It's a lot
God.
of communications mistake. So finally, we have made the passport number in the report. We given it in the last minute. So he has gone to the
The failure in
specific country.
communication.
Yeah. So after that, we have made a checklist today in our hospital that if any patient or person coming to a RT-PCR report for a foreign travel, they have to fill up the checklist with all intimations. Because each country has different guidelines and different formalities. See, Singapore is different. They have to take 2 RT-PCR report before landing into their country. So for that, we have made a checklist and we given the remarks column for the particular patient or any other patient. They can fill it up and give it to our hospital staff.
So good. That means I really appreciate the way you narrated this case, and also you talked about the remedy. I think CAPA is one approach that we have to really focus on managing all, complaints or any kind of feedback that you receive. That's the only way to improve. And I think most of the hospitals who are working for NABH or JCI are, using CAPA as the basic tool to improve their work performance.
Yeah.
So
if this complaint could not come, then we cannot able to address this issue.
Yeah. So good that you made good use of that opportunity of not only helping that patient, but also making correction in your procedure so that later on nobody gets affected in the same manner. Yes, Dr. Beauty, please continue.
Yeah, thank you, doctor. So this clearly shows how a small break in communication and what damage it can do. So thankfully you were able to manage it, but many a times these complaints do not come and they just go unnoticed, and they do bigger damage in the back end instead of having the opportunity to speak to the patient and try to solve the problem wherever possible, whatever solution you could give. So on the same lines, I wanted to speak about why we should welcome complaints instead of try to put them off or try to push them under the carpet. So one reason is, like ma'am said, dissatisfied customers are more likely to return if they listen. If you only listen to them, if someone took the efforts of complaining, means they care about you, they liked something in your service. It's if everything goes wrong, they would never come back and they would never complain. If something that they have liked, maybe 30% something that they liked and 70% they didn't like, or vice versa, but something they liked and that's why they are taking an effort to complaining to you. Complaints are a second chance for us to take an action and for us to build a relationship with the patient. Resolving complaints generally leads to loyalty. Most of the patients who have their complaints resolved become more loyal and they continue with us for a longer duration. They become kind of a loyal customer for us. They also become brand ambassadors for us. Ignoring complaints, that directly damages our reputation, because the patient would speak to 10 other people about the kind of experience they had, the kind of feeling that they received when they tried to complain and ignored them. We also receive a lot of valuable information through these complaints. Sometimes we don't even know what's happening because it's a place where we have to go every day. There may be some things amiss that we kind of, our eyes just don't notice because we go there every day. But if somebody, the third eye, that is seeing something, they would know exactly what is wrong, where, and when they say that to us, we should take it as an opportunity to understand if there are lacunae or if there are opportunities for us to correct those. Ease of complaints to legal authorities and social media. This is something that is really making patients go crazy and complain on the social media and use. Now, in fact, in India, there are portals where you can directly complain about your issues to Ministry of Health and Social Welfare, so family welfare. So that's something, if we are not giving the opportunity for the patient to complain to us, they would go and complain elsewhere, where we would have to probably spend a lot of time and resources in fighting that case or in trying to manage the solution. Manage the problem. Increased confidence at the personal level. If I am able to solve for a problem, my individual confidence increases. Right? Any other points you want to add? Anybody wants to add anything? Please put them in the chat. Anything that you feel apart from this should also be in the list here, in why we should encourage complaints from a patient. Okay, so the next piece is, so I believe there's nothing else, right? I've covered everything because I don't see anything in the chat here. What do we feel that the patients need when they come to a hospital? What do they need? Please put the message in the chat. What do they need?
Can I talk? Like, it's tough for me to write on the chat. I have connected through mobile.
Sure,
they of course they visit the hospital because they are in pain. They need a treatment. So first of all, they need to be heard. They want attention. All right, and they need immediate response from the care team. Yeah, of course. And as Sir said, Dr. Rajesh, cure. They need that. So these are the things. Yes.
So you said cure, somebody to listen to that patient, and immediate response. These are the three things that I got. Okay, training materials from practical life for employees, complaint record, important. Okay, relief from pain, of course, medical care, attention. Okay. Please keep them coming. Any other points you feel? Anything else? Relief from symptoms. Okay. No complications, of course. Access of services, yes, right.
Do no harm. No? There is a saying.
Yes, yes, doctor.
No, there is a saying in the ICU, do no harm to the patient.
Yes.
That is the first, more than curing, do no harm to the patient.
Right, and that's what the patients don't want. They don't want to come to us with one illness and go back with two. So that definitely they don't. Prompt attention, respect. Yes, absolutely. So I think you guys have covered most of my points here. So if I have to just summarize quickly, I would put them into 12 points here. One is they want control over their lives. So they want to be a participant in whatever decision as a doctor or as a care provider we take on behalf of them. They would want to be a partner in that so that they also have equal control over their lives. They would want to achieve goals. So that could be anything. That could be relief from symptoms, relief from pain. They want to walk again. They want to be able to do whatever they were doing earlier. They want to see clearly. They want to hear clearly, whatever it is. So they want to achieve goals that they have. They want to preserve self-esteem. So we talk about patient confidentiality. We talk about being sensitive to patients, especially female patients. So they would want to preserve. And they would not want just anybody to come and touch them inappropriately, or open. I mean, be lied naked, and then there are 10 people around that female or that male to be looking at that person. So they want to preserve self-esteem, be treated fairly, like somebody already mentioned, friendly reception. When they come to the hospital, they don't want somebody angrily or somebody irritatively or somebody having an expression, I already have so many things to do, now you're also coming here. So that kind of expression. And this happens. This is not something that doesn't happen. This happens every day. We know that most of our staff members are having a lot of work to do on their heads, but still being mindful that it just takes a minute to smile, and not even a minute. I think a minute is too long. About 15 seconds to just smile and receive the patient with a little warmth and just tell the patient to. I think nobody would agree that they would like something like that vis-a-vis what they generally are offered, right? They want to know what's going on. They want to be party to whatever's happening with them, what kind of tests are being given, what is the result, what does it say, what does it mean, etc. Security, they don't want to get hurt while in the hospital. They don't want to carry second illness when they come to us with one. They want approval, acceptance, and recognition. Okay, sorry, my screen is open. Both my screens are open, so one was overlapping one another. So they want that person is accepted the way that person is. Okay, they want to feel important. They want to feel appreciated. Because many a times we as doctors feel that we know about the disease more than the patient. We don't ask, or we don't appreciate the efforts that patient takes to go online and read. We feel that as something that kind of blocks our relationship. But instead, if we just see that as a point to appreciate, the patient would feel so. I mean, there'll be so many areas of communication topics that would open up immediately. Patient would tell you 10 articles that he read and something that clicked on his mind, some symptom that he feels that that is really, or some diagnosis he came across online that is really, that has taken away his sleep at night. So stuff like that he would open and speak about. If we just appreciate that he's taken an effort to go and read about it, or has spoken to two doctors about it. So that's something that we should really appreciate. A sense of belonging. We should make them feel alien. Okay. Honesty. This is a given in every place. So of course. So these are the 12 points I would like to summarize all of our discussions that we just had on the chat on the needs of the patient. Now, what does a patient want? So this was what I came with.
Beauty, just a second. Some of the participants have written good points that you have already covered, like Sharmi has written about transparency.
Yes.
Then Dr. Pai has written about feel safe in the hospital.
Safety in the hospital.
And Dr. Bala has mentioned about confidentiality and privacy. I think these are very important needs that patients come with. How many of us really identify? That's a question to be asked, Thank you. So continue.
Absolutely. Thank you, ma'am. So, so I came with these 12 needs. Okay, and now maybe one or two were not met with. And that's the reason I have a complaint to you. When I'm making a complaint to you, what do I want? What do I want out of that entire conversation I have about the complaint? I see that probably you did not treat me as maybe you treated somebody else more. You gave some privilege to that person just because that person is kind of your known or whatever. And even though I came earlier, I had to wait a little more just because you allowed the other person to go. What do I want when I'm complaining to you? Maybe I want to be listened to. I would really want that when I'm speaking to you, you give me all your attention and you listen to my complaint. That itself will cover for the 50% of. Can we cut down on theory? Sure, ma'am. Quickly. So we want to be listened to. We want to be taken seriously. We want to be treated with respect. We want immediate action wherever required, wherever it is necessary. We want some kind of compensation in form of saying if you were billed wrongly, then I will give you a discount and maybe cover for that or whatever. They want someone to be reprimanded or punished in some cases, and they want to clear the problem so that it never happens again to somebody else. So moving on, I'll be quick. I wanted to take some time on this next slide, but I'll be quick here. So there are, based on the kind of solutions that the patients come with, or the kind of solution these people desire, there are three major brackets of dissatisfied customers. One is passive responder, who will just not complain. They will just not complain. Even if they have a problem, they will just not complain to you, but they will go and complain to some other people. They will go and complain to 10 other people. If given an opportunity for them to complain to you, they may consider complaining to you. And these are the group of people who do the biggest damage to us, the passive responders. The aggressive responders get angry on anything, even the smallest stuff. They'll get so angry, they'll start using bad words. So these are the people who are generally not complaining outside unless it's a big damage that we have done to them. But when they respond, when they get angry on you, it depends on the way you respond to them, is whether they will complain elsewhere or whether they will come back to you or not. So if they are getting angry and you also match their tone with a little more anger, and then they get more angry and then they decide never to come back, or they decide to go and mess with our reputation. So these are the second category. The third category is the best and ideal. They generally find a problem. They also know the solution, or they kind of work with you to find a solution. So they'll tell you that, I found that chair is broken. Why don't you replace it, or why don't you keep it aside so that no patient sits on it and has maybe an accident or after sitting on it. So these kind of patients also we see that these are the best people we would want. They are problem solvers. All they want to be heard.
We lost your audio for the last sentence. Could you speak again?
Yes. So all three of them have one thing in common. They all want to be heard. They all want to be listened to. If you listen to me, I will speak to you. If not, I will speak to my friends and family and social media. When we are managing a complaint, when we are solving a complaint, there are some things that we should avoid, and this is in line with the steps that we'll see in the next slide. The steps that we need to take when we are listening to a complaint. So before the steps, I'll just quickly talk about what we should avoid. So I'll go from upside downwards. So siding against the organization. When somebody complains, we generally say, "Arey, ye hospital ka aisa hi hai. This hospital has been like this. I have told my management 10 times, but this doesn't change." That doesn't help. This only takes away your kind of trust, your authority, and your own. The patient will not value you. Patient will not value your work. He knows that you're working for this hospital and still you are not loyal. Overreacting, nobody wants that.
Beauty, could you have the slideshow on, because we are still on the
8 o'clock on TV too.
yeah.
Is it visible now?
Yeah, it's better.
Game
Thank you.
Magis.
I put my earphones also on.
9:30. 9:30.
Siding against the organization.
Dr.
Pai-
Pai, yeah, I have muted him. Yeah.
Okay. Siding against the organization is what I spoke about. Overreacting, no, it never helps with any situation. Non-verbal behaviors. We generally do not even pay attention to what our face is saying, what our hands are saying, what we are doing to our legs. Maybe we are fidgeting with something when we are speaking to this patient. Maybe we are typing and then we are talking. So that also does not help. Giving a run around, this sending that person from one department to another department, from one person to another person, doesn't help. It really damages. Even the opportunity that we had kind of is gone. Poor listening, citing organization policy, saying ye to hamara policy hai, this is how we do, and this happens everywhere. Generally, wherever there is a billing related issue, this is what is cited to them, cited to all the patients, saying this is our organization policy, this is what we charge to every patient. That doesn't help. Becoming defensive, again, doesn't help. Okay, any comments here before I move to the steps and then we'll start our practice?
So I think I would agree with you on this slide specifically, because I think this is what we normally see when we see hospital employees handling different difficult situations. Whenever patients come with a request, not only complain, with a request also. So this is a usual way I think we all health employees, respond. Do others agree with me, or it's just my opinion? Because I feel most of the times we say, okay, I can share my experience of just 2 days ago, day before yesterday, when I went to the
Yes,
hospital.
agreed.
Sorry, Dr.
I
Bala,
think
you were
Dr.
saying
Bala,
something?
yeah, he said he agrees with you.
Yeah. So I'm just sharing my experience here. I went to the hospital with my son-in-law because he was sleeping in the hospital for a good 3 days. So I thought, let me go and relieve him today, and he can go home and sleep, and I will go and sleep with my daughter on that night. So we both went, and when we went to the reception to make that visitor pass, it was around 8:39. So she said, sorry, beyond 9 to 6 we don't allow visitors. So visiting hours here are 9 to 6. So we don't allow visitors after 6 o'clock. I said, I've not come to visit, but I've come to relieve him, and I will be now sleeping with my daughter because he's been here for 3 days. But the lady on the counter, she did not, agree to it. But she just said, no, that's not possible. So we literally had to come home. So he came home to drop me back, because for me, it's a new place, so I cannot travel on my own in late evening. He came to drop me, and then he drove back. So sometimes even these policies need to be, really re-evaluated. Are they really making sense? Because everything, and unless it is really harmful to the patient or to the organization, these policies should be open to revising and, making it more patient friendly. So if everything is okay, the person on the counter has a ability to discern between uh, the harm that can happen to the patient, or if it is all right. And the other day when we went, they happily made visitors pass for us, and we all went in and we came out. So see, the same policy was not there in place a day ago, and this day I had to literally come back for this reason. So I agree with you that these are common reasons without thinking we give to the patients and their family when we say that's the hospital policy, we cannot do anything about it. I completely agree with you. Thank you.
Ma'am, just one more line I'd like to add. Many a times these receptionists or the people on the ground, they
Yeah.
find these lacunae and they keep it to themselves,
Yeah.
thinking that there is nobody for me also to go and speak to, because there's no complaint channel made, that and there's no repository, there's no repository of complaints, there's no register, there's nobody looking into it, nobody even
So it was not
thinking that,
complaint. See, for example, in this case, it was not a complaint. I
yeah.
think it's a request. So even when in ICU or in critical care areas, when the family members wants to visit the patient, we normally say ICU में कोई रिश्तेदार allowed नहीं है. So you can't go. It's only during the visiting hours. So in critical areas, I always say, please remember, maybe by the time you will have your visiting hours, that patient would have gone up.
Dr. Indu, I will be joining back in 10 minutes. Okay,
Sure.
I have some.
Sure. Yeah.
Madam, couple of things which I want to just tell.
Sure.
What you said about the policies of the hospital, nothing is written on stone. I fully agree. That situational sensitiveness,
Yes.
that should be there with each employee. There can be situations where we may have to allow a bystander into ICU at a different odd hour than the normal hours. So it is only, they have to think, bring some common sense in their, into their, activity, which they many times don't want to take that risk, thinking that somebody is going to punish them or, fire them. So, so that sort of a, institutional culture of giving some empowerment to the staff to take some decisions
Leverage.
based on leverage. Yeah, that should be there. That is one point. Secondly, I am also thinking in terms of, how, employees also should be kept happy. We can always say, they are always doing wrong. I think they are also stressed out. We discussed other thing there about compassion fatigue and all that. So are they sufficiently, manpower is sufficiently given to the, or they are overdoing their work? And so these are all certain points which we should consider, when we say complaints are coming from one particular area.
Thank you.
Okay.
Thank you for your
In fact, Dr. Rajesh, I totally agree on our staff members trying to do overwork and doing a lot of things, even out of their purview. But I feel if they do not know to be positive and do not be empathetic, I think that hurts them more, hurts them negatively, and kind of takes away energy from them. Instead, if they are, I do not agree with compassion and fatigue. I don't think. I mean, it's a theory again. I don't know if there is a measure to measure that. But I feel if somebody's if we can bring happiness into work, not just that big emotional quotient kind of a thing, or what I mean is, if you are angry with me and if I also get angry, both of us lose our energy. And unless either of us try to balance that and kind of come to a conclusion, come to a common place where there's no anger or there's no bitterment, and we both can walk happily from there, I save energy, you save energy, and we are able to do better work. So most of the times, I think the gap is where our employees do not know what they are doing wrong. They do not know how to correct it. So it's on us, on all of us, because we are at a senior position. We are the ones who are handling them. So it's on us to give them the platform where they can come and speak about their insecurities, their I mean, if they do something wrong, or we should be able to go ahead and tell them, this is not how it's done. Why don't you try this? Stuff like that. So I think that will save their energy, and even with the same kind of workload, they'll be able to do better. This is what I feel. It's totally open for debate, but this is what I feel.
Dr. Bala wants to say something. Dr. Bala, please go ahead.
Yeah, I have 2 points. One point that Sir has covered. So we should give the empowerment to the staff, really the non-working hours or odd hours. So they should know their empowerment. Then the organization should give the empowerment to the particular staff who is handling directly the patient care. So and also they should know.
I think flexibility where use their discretion to see how they want to handle. Agreed.
Yeah. The second point is that they should have the escalation matrix.
Yes.
Like in case of any doubts, or they should not able to take the judgment or decision, whom to consult, and in the odd hours who is responsible to take that call to take it. So that should be defined to handling the complaints.
So Dr. Bala, I really appreciate the point that you have raised. For example, if the staff can even tell to the patient or their family, sir, I can't permit you, but let me check with my seniors, and if it is possible, I'll try to see how I can help you. So if you are able to showcase the intention to help, they are happy. Even if you tell them no later on, sir, I've checked with my manager and he said it's not possible. I'm really sorry. I wanted to help you, but then this is something not in my hand. Even if you are able to manage in this way, they say, thank you so much. At least you tried for me. So that approach, that intention of helping has to be not only imbibed, but also demonstrated. I think I agree with you. There has to be escalation metrics. I like this word. There has to be an escalation metrics, and whom can we go? Or we can even say, sir, I'm noting down your suggestion. I will discuss about it and see how in future we can make sure that such problems do not happen. Even that gives them a lot of satisfaction that I have been heard and I have been given a solution. Thank you so much. So Dr. Beauty, I think we need to now rush 9:20.
Yes.
And
interesting points coming up, and we can all keep sharing, but I think we have time limitation. So we'll move on to the 1 minute. My slide is frozen. Just give me a minute. Okay. So these are the 3 broad. These are the 3 broad steps, very broad steps when a complaint actually happens. And the step number 1 and step number 2 is something that can be done either in the first instance when the complaint happens, or can be broken down into two. Totally depends on the situation, the time, the situation of the patient. If he's in pain, if he's in problem, if you have limited time, you can always, but that has to be communicated. So roughly, this is the structure that we will follow, and we'll do one or two, depending on how much time we have, one or two practice, just 2 2 minute scenarios, and we'll try to see if we can all, how easy or how difficult it is to just keep in mind these points and touch base on all of these when you are complaining to me. If I can just 1 2 3 or 1 2 3 4 things that I can do, how it changes the experience of the patient, or the kind of reception the patient gets after complaining. So very quickly, I'll read them through so we have clarity. So listening without interruption, very easy to do, at the same time very difficult. I have tried because I speak a lot. Now that I am into communication, I know how important it is to keep quiet at times. Avoid getting defensive, easy but yet very difficult. Use sad but glad statements, saying that I'm really sorry that this has happened to you, but I'm so glad that you brought this up. I'm really grateful that you brought this up. Express empathy wherever he says that because I sat in that chair and the chair is broken, I am now having back pain. Express empathy. I'm really sorry. I can understand how frustrated you are, how angry you are. I would be as angry as you are right now if this had happened to me. Stuff like that, using those empathy words. Be mindful of your non-verbals. Sometimes we don't realize that we are doing something else. We are fidgeting with a pen, we are fidgeting with our hair, or we are looking elsewhere, and we are kind of not looking, not making eye contact. Very basic things. We don't really have to get into the expression change and all that. That requires a lot of practice, and that's not something that can be achieved. And patients do not even desire that level of non-verbals from us. Only listening, smiling wherever required, connecting with the patient, saying with your non-verbals that I am with you. Whatever you're saying, I am with you. Ask questions to clarify about the problem. Do not justify if something is wrong. Do not justify. Nobody has ever complained, sir. We see 10,000 patients every day. Nobody complains about it. Don't use those words unless you are asked for a justification. Find out what the customer wants at the end of the complaint process. Explain what we can do, what we cannot do, but do not cite any organization policy here. Just say that this is in our purview, this is not in our purview, and discuss all the alternatives of that complaint result. At the end, make sure that we document everything, we update the right authorities, we take action, and we inform the progress to the customer, and we follow up. If I was the one who the customer had come and complained to, I would make sure after a week to find out if the customer has received any call from the department that is supposed to take care of that complaint. I mean, just on a personal level, it's a minute invested, and it's a lot of gives a lot of output. So we'll quickly do two scenarios. Should I stop sharing or should I keep sharing so that we know the points? Or maybe I'll just take a screenshot and post it.
Yeah.
I'll take a screenshot and post it in the chat so that we have the points ready in case we want to refer to. Sorry, I think this is not allowed here. So I'll share the screen when we are doing the skills practice. Let's first identify a very common and very easy meaning not a very sensitive problem to the patient when the patient is complaining, and we'll keep it limited to 1 minute. Only 1 minute conversation between any of us. Maybe I can play the doctor, or you can play the doctor. I can play the patient, and then we can see if you are able to, or anybody. You can play anybody. If you are health administrator, if you are head of the department, anybody. Can we do that quickly? Dr. Anu, would you like to give us a situation, a very common situation that happens every day, which is not too serious, but at the same time requires attention?
Okay, so what I'll do is like I'll be the patient party.
Okay.
So my situation is that like the hospital has told me to come I got an appointment at 9 o'clock.
Okay.
So I reached. So what they are told is that you have to come by around 8 o'clock to finish the registration process, and by 9 you can meet the doctor. and then whatever this thing. So by before noon you can go home. So
Okay.
so my this thing is that I have been waiting here. I come at around 8 o'clock. I had done the preliminary screening, registration. I have paid the consultation fees, but now it's almost 11. I have not met the doctor.
Okay.
So what am I supposed to do?
Okay. So let's do this. It was a good explanation that you gave. So maybe what I can do is I can request everyone to just keep an eye on whether I am able to follow all of these points. So Pooja, may I request you to observe if I am able to listen without interrupting Dr. Anup in between? Could you do that for me? Just observe if I'm able to do the listening bit without interrupting.
Okay.
Indu ma'am, can you observe if I'm able to follow the not getting defensive bit? I should not get defensive. And Dr. Bala, if you're able to observe if I use the sad but glad technique, whether I use any statements that say that I'm sorry for what has happened and I'm still grateful that he brought this problem up.
Yeah,
And
right.
yes, and Dr. Rajesh, if you can just observe, if I ask him open-ended questions to understand more about the problem, although I think this may not be as relevant in the situation that he's mentioning,
Okay.
but
Okay.
if I stick to open-ended questions, or do I keep only asking closed-ended ones? And
Okay.
Dr. Leah Raj, I'm not sure if I pronounced your name right. Please pardon me if I didn't. Uh, um, could you just observe if I avoid or if I refrain from giving any justifications unless he asks for one? Okay. I think there are no more points here, but if anybody else can volunteer, Pinky ma'am is not back, right? Mr. Khalid, are you here?
Yes, yes.
Yeah. Could you observe that I asked him what he wants out of the solution? I mean, as a solution of this entire process, what does he desire? Could you just
Okay, okay.
and Reena ma'am, if you could observe that I asked Dr. Anup about, or rather, I clarify about what I can do and what I cannot do, like all the alternatives of this problem. So maybe all of these points are not relevant here, but whatever relevant, and if I'm able to touch upon those, we'll hear about it. Okay, so I think Dr. Anup, we can begin.
Yeah. Okay. Yeah. So I have to speak to you, like.
Yes, yes.
Yeah,
So
okay.
so I am I'll play probably the receptionist, and I'm sitting at the reception desk, and now you've come to me.
Yeah. Okay. So
all others can switch off their video.
Yeah, that'll be great.
All can, yeah, we all can switch off our video.
okay. Yeah, madam. The thing is that no, see, I have got an appointment for Dr. Suresh. So thing is that like the call center has told me to come at 9 o'clock in the morning. See, we have been waiting here for the last 2 hours, and I see that the doctor has still not turned up, and I see that there are a lot of patients around here, and see you can see my patient is an elderly patient. She has just undergone surgery. She has got a stomach bag with her, and how long are we going to wait here? When is the doctor going to turn up? If you're not able to like give us appointment on time, see, this is what happens. What are you going to do?
First of all, I must apologize to you, Anup sir. You've been waiting for 2 hours, and I hope sir is fine. Can I do something for him? Can I give him some place for resting for a while? I understand he must be in trouble. Is that something that would help?
No, that should have been done. I agree with that. See, when I have spoke with the lady who was the doctor's assistant, she told that the doctor is going to come, give us another 5 minutes, and that 5 minutes has turned into 2 hours. And as you can see, the patient, like, she is very ill. She is so weak that her stomach bag is full now. And we have been like frequently visiting the attender the patients in this thing, and this is what she telling, that the doctor is an emergency, the doctor is on her way, the doctor is like he's almost here. See, how long are we going to wait here?
I'm really sorry for all this waiting, sir, and thank you for bringing this up. Why don't I do one thing? I'll just go and personally see the doctors here in the cabin, and I'll come back and update you. Does that work?
Okay, but I think before that, I think you have to give us a bed or something, or where she's,
Yes.
because I don't know whether your hospital has a policy of looking after the vulnerable patients. Because as far as I see, there are a lot of patients lying here, like who are very tired. They are just sitting in the sofa and like just passing out.
Sir, I can definitely do that. I can absolutely get a bed arranged. In fact, not only for your father, everybody who's here, I can definitely arrange for something. And I
But
think
will that
this
take
is a
longer
brilliant
time,
point.
or will, like, if you're going to shift her to the another room, so will the doctor come and see it from there, or like still I have to come back here?
No, sir, I'll try and request the doctor to come to you. I'll make sure that whatever can be done from my end, I will do it. If the doctor is in a position to come and see you without having to, waste a lot of time between, I'll definitely get that done. And I won't trouble sir if he's not in a position to walk back and forth to the chamber. I won't make him walk. And one great thing, sir, that you brought up, I should really keep this noted for all of our instructions. If the person is elderly or can require does require any kind of bed, they should tell us in advance, and we should be able to make arrangements for that. Thank you so much, sir. I'll just get back to you in a
And
minute.
one more thing,
I'll
what
go
I
and
would
check.
like to bring to you is that, see, it is not
Yes.
when I speak with others who are standing there. So I find that it is not the first time this is happening, because the bystanders, everyone is complaining that this is what happens here. The doctor is always late, and like there are a lot of people around here, and this is not the first time. I don't know how we are going to manage it, but thing is that, no, if you are not going to look into this in a serious manner, things are going to be very bad.
I agree, sir. I totally agree. And you're very kind that you came and spoke openly about it. I'm really thankful to you. In fact, I will go ahead and make sure that I notified the authorities about it, and I make sure that this goes to the right platform, and this is taken an action into immediately. And I'll even go ahead and keep you posted about it, sir. I'll make sure that I don't, as a hospital, I speak on behalf of the hospital. I will make sure that we do everything in our capacity, and we'll make sure that this kind of basic things will not be missing when you visit us next time.
Okay, fine. Okay. Yeah.
Okay.
Yeah.
All right. Thank you.
Thank
I think we can hear the feedbacks now. So, Dr. Anup, why don't we start with you? How was your experience when I was speaking to you? Do you think that is something that you would have liked to hear from a staff, or is still there some lacunas that you could have maybe felt? We can't really solve for what has happened, but at least the communication.
Yeah, I think this is the best that can be done, because generally, like, we have to take a defensive stand, especially with the doctors. They're either in the rounds or they're stuck up with some emergency. So either you can make a call to the OT or something, or can
Yeah.
tell that doctor will be delayed or something. Otherwise, I think it was all fine. Good. I think this is
Yes.
like what has to be done. Nothing else.
Yeah, I think listening is that okay. So I'll have my say at the end. Yeah, we'll start with Pooja. Pooja, what was your observation about me being able to listen without interruption?
Yeah, ma'am, the thing was you were nodding and there was minimal interruption. Actually, there was no interruption during the talk. And you were nodding the head, your facial expression were appropriate as per the situation of the attender of the patient. And one thing I just would like to mention, in this conversation, I felt, means doctor was looking some like faulty, as Dr. Anup said, that he has not come. So we are giving explanation for that. I think we could have used like, I'm extremely sorry, sir, for this delay, but there was some kind of emergency. So means the reason for delay is that. So we are really regret your inconvenience.
Totally. And in fact, I did not do that, Pooja, is because I do not really know what is the reason for delay. So unless I know, and I go ahead and say that the doctor was in emergency, and I find that the doctor is entering from the main door in front of the patient just now, that would have, I mean, that is not the good situation. So that's why I said I'll go and find out what is the situation, and I'll come back and update you. So that's the reason I did not. If I as a receptionist would have known that this is the situation, then I think I would have gone ahead and mentioned that. But good point. Good point. Also, as a receptionist, I should know what is happening with all these patients waiting in the area and why they are waiting. So good point. Absolutely. Ma'am, what do you have to say about the defensive bit?
So I think you were not defensive, because you did not try to mention anything that which meant that okay, patient is over expecting or is something that's not in our control. Rather, you were actually offering much beyond. I think any hospital say that okay, we'll make arrangement for bed, and we'll see how we can have beds for every patient. But that's something we really need to know, that can we really offer something like this? Because if we are giving something like, if we are kind of giving answers in that manner, are we not promising more than what we can deliver? But then we got to be really careful about that kind of thing.
Totally.
And especially if I look at the position of the person who is talking, if it's the front desk staff, so how much of flexibility or leverage do they have? I think we need to really consider that before we make any promises. And also talking in on behalf of doctor probably can be very challenging for you, because again we really need to consider the reality of this situation.
Yes,
That's what
Yes, and that's why when I said that, when he asked me very clearly that the doctor would come and see me, see the patient, that's when I realized that probably the consultant would not agree. And then I said, I'll make sure that he has to walk minimal, and I'll see what I can do. Okay. Dr. Rajesh, would you want to speak about what you observed?
Yeah, I think you have been very proactive in the sense you are listening patiently and allowing the bystander to vent his emotion, his concern regarding his parents, elderly parents. Just one thing, I think you asked only open-ended question. You didn't ask any, and your offering to help was very good. One thing you could have immediately done is to call the OPD and asked why there is, a delay. I think he came to the front desk, main front desk of the hospital. That's what I understand. Not to the OP where he went.
Or maybe OPD manager. You could.
OP manager. You could have called immediately and asked for what is the problem, why the doctor is not come, and maybe you could have got an answer at that point. That's the only thing I feel. And as madam said, there's limitation to offer things too much for them, that you may not be in your within your span of control of your, okay.
Totally.
Otherwise,
I agree on both of your points. Yes, I agree on both of your points.
Fine.
About calling and asking about the doctor's availability as yet. What I had in mind is I wanted to complete this conversation and then make that call. I didn't want to break that conversation, make a call in between, and then continue. So whatever works. If the patient is really apprehensive and wants to know right now, then I think it's best to make the call right now. Unless, but then still allowing the patient to speak completely and done speaking. That's when I should lose the attention from the patient and then start paying attention to something else. Dr. Bala, what's your take?
Yeah, you have mentioned about the, you understand his pain, and you've spoken about this, and also you have informed that glad that he has brought the point to you. And then, so my point is that Dr. Anup is a genuine patient. His voice is very low.
Very kind, very kind. When I told him to keep it simple, he kept it really simple for me.
But most of the times, the tone of the tender patient in the complaint is very high, and they will not allow us to speak for a second. So that's one point. So the service is good. And also you would ask that maybe if in the department 2 doctors available, is it fine that the patient can meet another doctor if he is free? So that may be one of
that could also be.
Exactly. Yeah.
So I think solutioning point of view, I should have taken a lot of points in consideration, but I was only paying attention to the communication. So promising the beds, at least for his father, I would have definitely done. But while going beyond that and promising for others was too much for me to promise, and then I didn't know the scope of availability. So yes,
Yeah.
point taken. Absolutely, absolutely.
Okay. Thank you.
Informing the OP manager is a very important step. No?
Yes.
I just feel every OP nowadays has a OPD manager, huh?
Yeah.
Yes. Yes.
Or supervisor, and informing them is a good step. Escalation, which Dr. Bala earlier told. Escalation should be.
Absolutely. Point taken. Point taken. Mr. Khalid, would you want to add about anything? Add something from your side?
No, madam, I think you are absolutely right because it was simulation of real situation. So if we think it's a simulation, then from your part and Dr. Anupal's, both is okay. Both are okay.
Okay. Okay. Thank you so much. Um, Reena ma'am, and I think Dr. Leah, Dr. Leah is not here, no?
She'll be joining from her phone. Yeah.
Okay, okay. Yes.
Yeah.
Reena ma'am, do you have something to add?
Yes, everything was really good. I was actually imagining, see, this is the work I do every day in the hospital. Deal such patients. So I was observing both of you. Dr. Anup, you're so loving. I wish all the patients are like you.
Absolutely.
We get such positive feedback every day. It would be really easy to handle people, but the real situation is not like that. They would come in a very aggressive way. What the hell is happening here? Is this some kind of joke? My time has no value. What bullshit you're doing over here? You've taken money, you've called me in advance. My patient is hungry, the patient is diabetic. If something happens, who will take care? You will straight away admit in ICU, you will charge me so much. And then what happens next? When you give time, why don't you stick to it? This is an everyday scenario. So I was just imagining. So yeah, we do have such cases. And yes, somehow we manage the tone of the voice and the way we try to calm down. I would not agree to offer a bed. That is impossible.
Yeah.
When we feel sick, we search for where to lie down. There is no place. The emergency people, they would shift the patient immediately. Bahar le jaiye, ho gaya, go, go. It's like that. So it's not possible. There's no space. But yeah, definitely special cases, we would definitely do something. We would talk to the point which all the seniors said, OPD manager should be informed about it. That's
Informed.
very
Yes.
important.
Yes.
And being in your place, I would definitely I would have the numbers of the doctors. I will call him that how far are you? I mean, how long would it take? And we'll try to explain that, okay, just 5 more minutes. The coordinators are there. They keep calling and following up. Most of the time, the doctors are in OT, they get stuck over there and it's not possible. So when we give the OT point, the people understand, okay, this is an emergency. Okay, he can't just leave the OT and come and see, but things can be managed. Otherwise, okay, by your tone, by apologizing and everything, you did very well. So nothing much, all good.
Right, right. And brilliant point brought up, Reena ji, that most of the times it so happens that our doctors are stuck in OT or some kind of emergency, and they cannot make it on time for the OPD patients. And that's where I think we can be a little proactive and inform before the patient has to come to the desk and ask
Yes.
about the doctor's whereabouts. Instead, going ahead and saying that, the doctor will be an hour late. If you want to, if you're done giving your fasting samples, you can go and eat or something, that kind of arrangement that the patient is able to take their own decision as to how they would like to spend this 1 hour that they have now extra, whether they would like to wait there or they would like to go and take a walk and come back or whatever. So I think that is something that really helps, which is a very small thing to take, but then it's missing most of the times. So
I think
that's
one thing I
also-
completely agree. Valuing patient time is something that we have to really, bring in our approach, and then willingness to help them in whatever possible way we can. So for example, even if we need to refer them to another consultant and offer them, okay, your doctor is not available, but I understand you need to consult, so can we help you with another doctor? Will you be comfortable? Because sometimes they agree, sometimes they say, okay,
Yes,
if you
ma'am. This is a very good solution. We also do that. Try to waste
in
time.
case if or in case if they're very keen to see their consultant because they have been regularly following up with them, probably they'll say it's okay, I'll come again, but the next time I shouldn't have the problem. So I think being proactive in our way of managing this situation is probably the thing that we need to, and also be innovative with the solutions that you can think of in managing such crisis situation. And Reena, we will be talking about how do you handle aggressive patient party in the coming session. And I would want any one of you who can act as an aggressive patient party, and then we'll do the role play. How do you really go about handling that?
No, Mama, I will be the one. I act very nicely.
I'm sure you must be experiencing a lot of it. So we will have you.
I thought I'll share this with all of you in today's session, but somehow my system, the laptop was not working. Now it started. I'll again re-log in with the laptop. So it happened today. It was really bad. I mean, I do understand the protocols, the papers, but one thing should be very clear, like patient's life comes first, then the paperwork can happen, then everything can happen. But the corporate hospitals, they give so much of importance to ye paper pe sign nahi hai, yahan se lana hai.
We are not going there, Reena, we are not going there. No.
That's a black hole.
We don't know. They have their own reasons. Documentation is a very important part. We cannot deny its importance. It's all
Otherwise
because
the hospital
denying. Yes, then we have.
They would risk closure if they miss documentation. So
small errors in documentation can lead to big legal problems for them. So we'll not go there. Okay. So I think
I'm just exiting and I'm logging again.
Yes, Dr. Rajesh, you want to say?
Yeah, I just want to appreciate Dr. Anu for being the very,
very
kind patient person, cordial.
Thank you, doctor.
And also, Dr. Beauty to be, listening to him, in a very patient manner. Very good, very good, role play done.
Yes, just two summary points, ma'am, and then I think we have little time, so I think we'll close here. Just two summary points, something that I wanted to talk about and I missed. One is when Reena ma'am and you also spoke about not offering solutions that are not probably in our control. I totally agree. What is in our control is listening at the point in time when the patient is speaking, not being defensive, not being judgmental, not taking it personally, showing empathy. These are all in our control. And we can always say that, sir, I really don't know about the doctor's availability as yet. Let me find out. And I think just that, and the patients also know that very little is in control of that particular designation. They don't really expect you to do stuff. So that's something that I wanted to speak about. Second, when you spoke about willingness to help, and we should also make sure that we use words that express our willingness to help. Like, sir, I want to help you. Just give me 2 minutes to find out what is happening. Stuff like that. Just using that word that I am here to help you. I want to help you. I can do that to help you. Or I could speak to my manager and find out how we can help you. Using those words that through those that we can show that we are here to help them. I think that helps. So just these two summary points. And before I close, I invite anyone to share anything. I really wanted to do at least 2 scenarios, but I see the time is already 8:20 and we have little time. So thankfully I had an easy patient and I didn't get to hear things that I would not want to hear before my dinner. But thank you so much, Dr.
Thank you so much. Thank you, Beauty. Thank you. Thank you so much.
Okay, thank you, ma'am. Thank you so much. Have a good evening. I hope I have done justice to your time. And given an opportunity, I would love to join this forum again.
Can you share your PPT with us?
Yes, sir. I can. I'll share it to Dr. Indu and she'll share it to all of you then.
Thank you so much.
Thank you.
Thank you so much.
Excellent.
Bye, ma'am. Have a good day, ma'am. Thank you.
It's an excellent session.
Thank you, sir. Thank you so much for your support. All of you were very kind and very supportive. Thank you. Bye-bye.
Your presentation is also beautiful. Thank you.
Thank you so much, sir. Thank you so much. Thank you. Bye-bye.
Bye.
So this is how we will be trying to, cover different difficult situations and learn the right way of handling it. I think this is something which is probably very, very basic, where day in, day out, we get to hear about some request or complaint. And if you can address it, if you can manage it, if you can resolve it, it's like very rightly said by Beauty, it's the second opportunity to, send your patient satisfied. So complaint can be there even with a satisfied patient, but if you are able to handle it amicably, you can actually send the patient satisfied and, make the patient come back to you. So with this, we now move on to the two presentations that we are expecting Dr. Pinky and Captain Sandhya Shankar to do on two different pedagogies. And I hope, Dr. Pinky, you're ready.
Yeah.
Thank you. Thank you.
Should I share my screen then?
So I have already enabled, anybody can share. So I think
how would I enable you? You can tell me once I finish. How should I enable you?
No, you don't have to, because I have gone on to multiple. Yeah.
Are you able to see my slides?
Yes.
Okay. Yeah. So I don't, forgive me. I mean, this is my attempt, as you told us. So I try to manage something. So should I start?
Please, ma'am, go ahead.
The quiz, I just looked up some material and I've tried to gather some information. So quiz as a training tool, I found a definition also somewhere, which was very interesting. So this was quiz uniform intelligence zone. I don't know whether it is right or wrong, but I found this. So I put it here. So as we all know, it's a medium for quick and informal assessment. And so I thought that I'll put a small, very, very small quiz just from the material, from the course material, which Madam Indu has used. And also from the like earlier presentations or course material. A very, very small quiz. Anybody can answer. The first one to answer will be the winner. Okay, so here we go. So the 73855 is the rule for official communication, professional communication, or personal communication. Anyone?
Professional communication.
Any other?
I think it's the rule for all the communication, isn't it? This is the Mehrabian rule, which we all follow. So it is all the options are right. Everybody watches 55-38-7.
Okay, probably. Madam Indu can correct me, but I found there in that course, but it was about personal communication. But I think for all communication, this may be true.
All communication. It's all communication.
It's all communication.
It's all communication.
Perfect. So then the 7 represents the body language, voice tone, or verbal?
It is the verbal.
Correct. Absolutely right. Then 55 represents?
Somebody else.
Body language.
Body language.
Somebody else? Body language. I think it's right. So, so that was a small representation of all of us, trying to recall what we have learned. And so I go on to the next one. So that's what quiz is about. It's a good medium for having some concentration of your audience, recalling information, and for identifying gaps in knowledge, building confidence, and helping us retain information. So there are different types of quizzes we have come across since childhood. We've gone through various types of quiz, personality, score, multiple choice, and all. And here, when I was making this small presentation, I was recalling that Coffee with Karan show. He would have a rapid fire rounds wherein he would say yes or no quiz, true and false. So it's a fun activity as well. So we use it quiz, in various fun or ice-breaking activities. I know of a previous hospital where I was working, so corporate hospital, before any, this thing, P&L meetings where it was a little tension wala situation, all of us waiting for our presentations, we would always have a small presentation before our meeting so that, there was a little bit of ease and a little bit of relaxing, relaxed mind before the top management is sitting and you have to present something. So a small kind of, trivia quiz helps in relaxing and opening up for the presentations. Then the top ways to use, so many ways to use the quiz, like it is pre-employment trainings where we use a pre and post training feedbacks, or we use it in regular trainings, or I think we use in individual assessments. I think Madam would know that in particular hospitals, in our hospital, they use a Thomas profiling, I think, for when you join or for recruitment. So you to assess an individual. So these kind of quizzes do make up different kinds of uses are there, and there's a variety of range. For example, in our child, we used to watch TV. There used to be brilliant quiz and all, some very, very scientific quiz competition among the schools, inter-school competitions and all. So there's various. Yeah. Bonvita.
Oh, yes.
Bonvita quiz.
When we were kids, we watched this.
Yeah. So now today, because of this pandemic and various learning platform integrations have opened up. So thanks to the easy assessments, the advantages of an online quiz are there. It is easy, but there is some disadvantages for an online quiz. Is like sometimes it's too easy, and you can tap the wrong answer. Then there is some, it doesn't allow much of open response questions or discussions. So advantages of an online quiz could be that, it enhances, promotes you to be a computer literate, timely feedbacks, self-pacing, a lot of variety you can have, various pictures, videos, whatever you want to. Then it enhances individualized learning, and availability and autonomy is there, and the audience can adapt. You can adapt your quiz to the audience, in fact. So some do's and don'ts of using a quiz as a learning medium. I think we should let the audience know how big the quiz is, have relevant questions, limit your distractors, design your performance-based quizzes as per the application skills and not as per factual recall. And try to teach while you test, and do have a work-related quiz. Some don'ts are that don't ask questions which are not covered, because it may discourage the audience. And don't ask same repetitive type of questions, negative questions, and don't make it too hard or monotonous. Some advantages. So it puts you in the right attitude for learning and discussion. It raises your curiosity and interest, increase self-esteem, and audience actually reads the material and leads to intellectual growth. And people look forward to quiz as it is engaging. And some disadvantages could be that, it may require some inhibit your high-level cognitive evaluative skills, or we may be testing only the logical interpretative skills. It may restrict your insights. It may not be accurate reflection of how much progress has been made, and sometimes may wrongly reflect on the trainer assessment. And for online, of course, you need to know the internet and have basic communication skills. So that's, I think, my takeaway, or our takeaway, is that it's a good engaging medium if used well. So thank you for the attention. And so let's have a small discussion around this as to how you all would want to, talk about a quiz. What do you feel about a quiz?
So can I request everybody to have their camera on so that we all can see each other? Unless you are in travel, then I understand, of course, you. I've received a couple of messages that 1 or 2 people will be in travel. Thank you so much, Dr. Pinky, for this presentation. I think we are not using quiz very often as an activity in the session. But trust me, every time I have used it, I found it very engaging, very interesting, because people suddenly become curious, okay, what is the answer to it? And maybe people have already done this earlier, or they are, they have an idea about it, so they suddenly become very, curious and engaged in the quiz. So I want others to share their opinion if they have ever used quiz in their training pedagogies as one of the pedagogy. Never?
Yes, ma'am, I can share my experience.
Sure. Yeah.
As trainer and also trainee,
Mhm.
if we go through pre-assessment quizzes and post-assessment quizzes before and after the sessions, and we found it too much, very much fruitful, because in case of pre-assessment, there is a pre-assessment of the audiences also, and the participants also pre-assess themselves.
Yeah.
To what extent they know the contents of the session, and after post-assessment, the trainer can assess himself or herself, and the audiences also can assess themselves. And also, after pre-assessment session, the interest within the audiences grow to a little bigger
Yeah.
if there is no pre-assessment. So I think it's absolutely very much effective tool, even in short pattern. And not like that I need to put 10 or 15 questions, even 5 questions or 2 questions may be enough to raise interest.
Thank you. I think that's a wonderful input. I have used it a lot of time. Pre-training assessment, I think we all do. And trust me, when you will do it, even with the senior people, they get to get grounded. They get to realize, okay, I thought I knew everything, but actually not. So if you are going to cover that content in your program, so as a pre-training assessment, if you can ask those questions and help them see what you're going to cover, and also help them realize that, oh, I don't know this. So that's a very good way of using it as a pre-training and post-training assessment. Thank you so much, Dr. Saifuddin. Anybody else who has used this as an activity in the program?
We use it in our NABH trainings sometimes.
Yes. It can actually be used very often, maybe every, before you begin a topic, you can use it. Even when you end a topic, you can use it to recall. So if you remember when we discussed facilitation skills, so I had used a quiz with 10, 15 situations, and I asked you, how will you handle it? So I'm sure that must have brought in that insight. Oh, I didn't know that this is the right way of handling this situation. So it can be used at any level of the program. It can be in the beginning, it can be in the middle, and it can be even at the end to recall, to know that, okay, I forgot this. No, yes, everybody has answered, so I know the exact answer of it. So that's another good way of recall. Or if there's any miscommunication, that can also be corrected at the end when you do something like this. So what are the do's? What do you think? What points we should keep in mind when we are, doing a quiz? Can you, because Dr. Pinky has already shown us the presentation, so you all have read it. So I am asking you a question to recall. What have you? So what do you think are the do's?
So we must make it interesting, I feel.
Yes, interesting. Very good. Interesting.
Some questions should be simple enough for them to answer first.
Excellent. A right to make. Don't give very hard questions. They will get discouraged. I don't know, so let me not do it.
Yes.
Very right.
So
preferably either start with simple and go to difficult, or have a right mix. Like in Kaun Banega Karodpati.
Yes, yes.
Some of the initial questions are so silly that you wonder, why are they asking these questions? Everybody knows, even a kid can answer it. But that's how they have built it, to engage the audience as well as the participant. And then they, make it harder when the larger amount of money gets involved. Wonderful, wonderful. Then what else? What are the do's and don'ts? Even don't you can cover in the same discussion.
In case of those, it should be relevant to the contents to be delivered.
Yes, very right. Yes, very right. And especially you have to cover that. If you're not covering that at the end of the session, they'll say, what have you done? You've just, created hunger, but you have not given us the food to eat. Very right.
And that will be discouraging also then. That will be, that they may lose interest.
People may lose interest. Very right. It should not be very long. If it is too long a quiz, again, people either can get disengaged or they might find it, what is this? You are doing a fun activity. When are you going to talk serious issue? So let's come to the point. So we got to keep maximum, maybe not more than 10 questions, 10 questions at a time. Any other do's and don'ts that come to your mind?
The statement of the question, it also should not be so long.
Yes, it should be brief to the point. Don't make it too complex. Too many no's, too many yes. So a person can get confused. How do I answer this? How do you answer? How do you answer it? Then it has to be sensitive, culturally, socially sensitive quiz. It should not reflect bad of any religion, caste, country, or place. We have to be very careful that it should be culturally neutral.
Content.
Yeah. So it should not be, and we have to be mindful of even like it has to be, what do we say, politically correct. It should not sound like a biased kind of a quiz. Any other thoughts about the do's and don'ts?
No patient name or organization name should come as in the question. So
yeah,
like if you quote,
of course, that's patient's privacy. That very right. That has to be taken care of. I completely agree. Yeah. So that means
there should be some kind of reward after the quiz so that people are excited to participate. So rewards matter. Like, okay, after the quiz, okay, you won, so a small gift for you, maybe a chocolate or something. So that makes it good. If you keep the rewards in front, they're more excited. Mujhe jeetna hai, mujhe jeetna hai. So
that's also true. Yeah, I agree. But at times, even verbal appreciation and acknowledgement of their answer is also a good way to reward, because practically it may not be always possible to do reward, but then of course acknowledging and appreciating their contribution is also a verbal reward for their participation.
Nowadays, madam, for CMEs and all, they will keep a quiz at the end. So one is to attract the audience, and second will be to retain them, and make some prizes at the end so that the audience sits through. And the questions, of course, are from the matter which is covered. So this is normally happens in our medical conferences.
Wonderful. So I mean, that's the purpose. I think they're using it so that they can retain the attention of the audience. Again, a good idea. But I think we should use quizzes, because for a 2-hour session, if you have maybe 2-3 minutes quiz at 2-3 multiple places, it would be a good idea. So you can integrate it in your not only communication program, but all other trainings that you are doing with your audience. Anything that we have missed? It has to be short, simple, familiar, then culturally sensitive or neutral, culturally neutral. It can be used in the beginning or in the middle or at the end for different reasons, for different purposes. So make sure that you use it in your future programs. Thank you. Thank you, Dr. Pinky, for doing such a good job. So that's a good beginning. So you are our opening batsman. I hope the others will play it equally well. Yeah. Thank you. Thank you. So Captain Sandhya, are you there? She was traveling. I saw her in the car. So I'm not sure if she has joined back. 1 second. Let me see if she's there in the...
Can't see her in the group.
I don't think she's there. So can somebody message her or call her? Dr. Pinky, can I request you to?
Sure, I will. I'll just.
Okay, so by that time, Captain Sandhya joins us. Who all are going to present in the next week? So tomorrow's session stands postponed because my daughter has come home just last evening. So we are still in the process of settling down. So for this week, we'll have only on next Friday, but then maybe we'll have on Friday, Saturday and complete it. Or even if you're okay with once a week setup, I'm fine with that if you're okay with once a week. Is that okay? Once a week is okay? Whatever you say.
Madam, so it's a boy or girl?
It's a boy. It's a boy.
Oh, great.
Thank you so much.
Grandson.
So here, sir,
congratulations.
Thank you so much.
Congratulations.
Thank you so much, everyone. Thank you. Thank you. So here they do gender reveal right in the beginning. So they already had gender reveal party and they are already put on the social media. So we knew it was live, but we were concerned about their health because at the end she developed some health issues. She had gallbladder stone. So they were contemplating now what to do, what to address, gallbladder or the delivery. But thankfully they have delivered
Gallbladder thing settled, madam?
automatically.
Oh,
As
wow.
of now, at least, yeah. Automatically it has settled. Her
Not picking up her call. She's not picking.
Okay.
Mm.
So we'll give her a minute's time. Meanwhile, we can discuss about the future, this thing. So the future sessions will be, the next session will be on coming Friday. And I have sent a questionnaire to all of you on your communication style. So please note down the 4 sub-scores for all of you because they are going to be discussed in this session. The format will be where we will be taking up one situation, a difficult one, Reena, this time, like you said, something like where the patient part is really aggressive, because I don't want to give you impractical solutions or impractical, techniques that do not work on the ground reality. So we'll do a couple of role plays and I have a couple of videos to show you, and we'll be using that communication style profile that we have done for all of you. So that will really give you an insight about how are you handling the situation, and then how you can work on your handling, style and make things better in your this thing. And you can use this tool, this questionnaire I've already shared with you in the content. It is there in the background at the end of the content. So you can use this as a assessment tool, and it really helps because when you help your participants know their communication style, they feel better. They feel, okay, I know now what is the right way of doing it and how I am handling it. But this we'll cover in the next session. I needed to know who all are going to do the presentation next week. Dr. Bala, you have said that you want to do it next week. You can choose. I mean, I want 2 people to consider next Friday. Any 2 can opt. And before you present, it will be good if you can speak to me over the phone once. So you can message me and we can fix a phone call and we can talk about the the format of your presentation so that we go by the protocol. So any questions about today's session? Or any feedback or any verbal comment? Of course, I'll be sharing the feedback form with you, but I want to understand from all of you, any feedback, verbal feedback about the...
Ma'am, since I could not join and I joined much later once you started and Dr. Beauty was also presenting. So what was the topic we were talking about? Was it like feedback?
Yeah, it was managing and resolving complaints.
Okay.
It was managing and resolving complaints, because that's one thing that I think most of us do it day in, day out. Patients would come with a complaint or a request. I would say even request has to be handled in the same manner. You got to listen to the patient and see how you can help the patient and address it. And if you can't address it, can you escalate it to your seniors and see how that patient can be helped? So I think 2 things that you have to really imprint or communicate to your trainees is, one, that they have to demonstrate the desire to help. That's very important. And they also have to make an effort to see how they can really help the patient, unless it is completely impossible. But when you're able to demonstrate, they go satisfied, okay, you tried from your side, but that's all right. So straight away saying no sometimes also can be very, displeasing to the patient party, that you didn't try to help me and you're so, unhelpful and uncooperative. If you remember last time I shared my experience at the airport, that I said that I haven't got the chairs, if you can help me. So for a good half an hour, she made me stand and she didn't help me. And then in the end, when I went to her, she said, don't disturb her. The other one, the senior employee said, don't disturb her. For a minute, I came back and then I said, I want to give you feedback for your behavior. You are wearing this red jacket which says, "May I help you? Please remove this if you don't want to help." So I was not rude, but then I was very straightforward to her, to tell her that if you are not ready to help, then why wear that jacket which says, "I want to help you"? And this is what we do. We don't have a jacket, but we have it written, "I won't help you." Or we have it written here, "I won't help you." So that's the expression we should not have, rather we should be willing to help. So what do we do, Captain?
Joining, madam. She just called me. She's about to join.
Okay, that's so good. So meanwhile, can I share the feedback form so that we can save on time? And give me 1 second to see where is the feedback form. So I've shared this feedback form in the chat box. I think Captain Sandhya has joined. So if she can.
Yes, ma'am. I'm sorry. 1.5 hours on road. I was terrible today. I just stepped in. Sorry.
My good friend says that's why I didn't even ask you to participate. I said, okay, let her just listen to the
But
discussion.
I'm ready. With my story.
Yeah, please, please. Yeah, we are
Okay,
waiting for you.
15 minutes. Okay.
Yeah.
I just need 1 second.
Sure, sure. So Captain Sandhya is going to talk about storytelling as one of the pedagogies of training. And she'll be making a presentation around it. Yeah. Please go ahead. Yeah.
Right. So before I start, good evening, everybody. Before I start and we start talking further, just want to know who all are comfortable with and understand Hindi. A little bit. Reena, you don't have to raise hand. So Pooja, Dr. Bala, are you okay? Do you understand Hindi? Are you comfortable with that? Rajesh sir.
Yeah.
Thank you. Dr. Khalid, are you okay with Hindi?
I do usually understand, but a little bit problem sometimes.
All right. Okay, feel free to. Dr. Bala.
Madam, make it English, madam, please.
Okay, fine. So, all right. So I'll use little bit wherever it's. I'll use a mix of both. There is something very interesting actually, and something from from the epic era of the Treta Yuga, and which is actually going to gauge your attention, but the entire impact will be felt and will be actually experienced by everybody when I talk in Hindi. So I'll make a mix of both, and so here it's about the training pedagogies, and I have selected the method, the storytelling method. And although before we get into the jargon of say what is it and how it is, what we need to go about, but let's understand. I just want to share one of the interesting episodes I came across recently while I was surfing through the podcast, because it was my mother-in-law coincidentally who asked me to look for an episode of Ramayana. And what I came across was mind-blowing. So this is it. And you can make out from this picture. Any guesses? What is happening here? Any guesses? Anybody? Anybody? So sir is saying something, but everybody has got some or the other thing in their mind. Probably there is a thought, something is spoken, but the way they are perceiving, they're probably imagining. And last, okay, he lands up asking me, and what about you? So coming straight to the point, I'm going to tell you a story, a very interesting story, which is from our Treta Yuga. And you must have heard about those 4 yugas, Satyug, Treta, Dwapar, and Kalyug. So it's from this Treta Yuga, where the legendary epic was written, and that's Ramayana. And the story is about everybody, whenever they say about this word is taken, Ramayana, the 2 names figure, Ram and Sita, isn't it? And again, there is a frown, and then again the name comes as Kaikeyi. Oh, Kaikeyi. Then again Manthara. She's the one who was the evil who has sent Lord Rama to jungle. Yep, Kaikeyi ki ye baat thi. So, and now I'll just use a little bit of Hindi on this. Kaikeyi was the 3rd queen of Raja Dashrath. And here I'm going to talk about Raja Dashrath, who had 3 Ranis and 4 sons. And Kaikeyi was the youngest one and most dearest to him. We all know, the entire world, and especially every nook and corner in the country knows that she was the one who actually got influenced by one of her maids by the name Manthara. And then she went to Raja Dashrath and told him that you owe me 2 wishes you have promised me during that, the epic war with the Devas, between the Devas and Asuras. So I want a return, and please give me give those 2 wishes to me. And the 2 wishes were, she asked for a kingdom for her own son, Bharat. And she asked an isle of 14 years for Lord Rama, his wife Sita, and of course, his younger brother Lakshman, he followed. Now, this is the story we all know. The children know, the adults know, our grandparents tell us, everybody. But what is yet to be known is, was she really an evil to send a god to jungle, or she was a saint? Now, there are 2 schools of thoughts which actually are found. But diving into the deeper pages of Ramayana, and study was done, actually been unarchived at the literature department of Banaras Hindu University, are again one of the legendary universities and gurukuls of the country. So, and it was actually said that Kaikeyi, who was one of the very brave princess, and she was the daughter of Raja Ashwapati. Raja Ashwapati was wanting to bring up his daughter like equally compatible in skills and competencies with all the boys in the family. And that's the reason when he groomed her, he had sent her to Gurukul, and under the Gurukul of Rishi Durvasa. If you recall Rishi Durvasa, one of the most capable rishis in Indian ancient history, but the one with very high temperament and would curse anybody, but very easy to get angry and very easy to be happy and to be pleased with. Kaikeyi has gained all the wisdom, all the arts, literatures, education in his Gurukul. And while she was to leave, Rishi Durvasa was very happy with her, and he told her that you will actually have a mixed type of life. Your husband will actually lose his life, will die while crying for his son. And another thing which I see in your entire horoscope is, for next 14 years after you get married, soon after you get married and have your children, for 14 years, whoever actually owns the throne of Ayodhya, of your kingdom, will be the reason for the complete demolition and extinction of your Raghuvansha, that is, jo khandan hota hai, unka. And Kaikeyi knew all these things, and she got married. And now on the other side, dusri side mein, there is an important story which goes here is a story of Shravan Kumar. Shravan Kumar is one of the sons and role model in India when Indians have to give an example of dedicated and most sincere sons to their parents, who are sincere, who are loyal, and who are one of the, I would say, the best proving buddies and boys to their parents. So, and this is the story of Shravan Kumar. I'm not getting into the story, but the more interesting thing is both the stories have got very strong connect. When Lord Shravan Kumar, to when his parents were towards their old age and it was time for them to leave the world, they knew prior, and they told their son that, son, could you please take us for a visit to all the dharmsthans, all the religious places in the country. We call them Char Dham ki Yatra, and Char Dham ki Yatra ke liye agar hame le chaloge to hamara marna safal ho jayega aur hame mukti ki prapti hogi. And it was a coincidence that Shravan Kumar's father was the Rajguru of Kaikeyi's father's kingdom. And he was the one who mediated the marriage of Kaikeyi and Dashrath. And, and after the marriage, Raja Dashrath was always pleased with Kaikeyi. And Kaikeyi, the brave lady, would never leave her husband for anything, anywhere he went. And once, because of his bravery, when Raja Dashrath got an invitation and rather a request from the Devas that they were too much threatened by the Asuras and their kingdom, and and the heavens were at threat, they invited Raja Dashrath to come and save them. And when there also she followed her husband and she chose to be the rider of his chariot. राजा दशरथ ने अपनी बहादुरी का सब जगह परिचय दिया, उन्होंने असुरों से देवों की रक्षा भी की. But while he was surrounded by all the enemies, what happened? The wheel of his chariot just got broken, and that was the time Kaikeyi has used, and there is a reason why Kaikeyi has used her little finger as a nail, and the chariot was stabilized, and he could actually fight the war with a lot of courage, all the bravery, and have the victory for the Devas. But Kaikeyi's finger and the entire hand was made of Vajra as a blessing from after her earnings and the blessings which she received from Rishi Durvasa. So during that time and after experiencing that victory, Raja Dashrath asked Kaikeyi that I owe you everything. Please ask me, what do you want? Then she said, I would actually ask 2 wishes, but let the right time come. I have everything, and I don't know. I don't need anything as of now. It went on, and that's how once it ended. On the other side, and Shravan Kumar was actually, he set out taking his parents. Rajguru said goodbyes to King Ashwapati and the entire kingdom, went for his Deshatan to with his son. It was on the banks of Saryu River late in the evening. Shravan Kumar has just put his parents on one side. They were thirsty and went to the river to fetch some water for his parents. And that was the time Raja Dashrath, who was on hunt, a young, brave king, and with all the energy and expertise, he was on his hunt. And while the Shravan was actually fetching water from the river, it actually felt that there was an animal, there's a deer who was drinking water, and he just left his arrows. And it actually hit Shravan and he died. And while he was dying, the king ran to him and told him, held him. King was sad. He was feeling very guilty. Shravan just said that, please feed my parents. They are thirsty. And when he went to his parents, leave aside everything, but the end result was when the parents realized that he's the king and he has killed his son by mistake. Still, they didn't do anything, but they said, the way we are leaving this world and we will die remembering our son without him, it is the same way you will lose your life and you will leave and depart from this world. Going forward, that was the reason. Now here, coming back to Ayodhya, when the 4 brothers, Ram, Lakshman, Bharat, Shatrughan, they grew, And it was time for them to own the throne. And it was time for Raja Dashrath to declare that who's going to be the owner of the kingdom of the throne. It was the time when Kaikeyi has to intervene because she loved Ram more than anybody else. She remembered the two statements which were there in her horoscope, which the great Rishi has told her. And that Raja Dashrath has to actually will go from this world, will depart from this world crying for his son. This means that someone has to die. His beloved son has to die, and because of the son's death, he will go crying from this world. So that was the intelligence. She said, let him actually cry for his son, and let me just separate them. And this was the first thing. And second, he did not want Lord Rama to be responsible for the harm and the destruction of Raghuvansh. And that's the reason, because for after the Raja Dashrath, if 14 years somebody else is sitting on the throne, will be responsible for the destruction and extinction of the Raghuvansha. And that was the reason she just asked return on materializing her two wishes from Raja Dashrath and send Lord Rama to jungle. And she actually asked the throne and the entire kingdom for her son Bharat. Lord Rama knew everything. He was the god. He knew everything, and that's the reason he never got angry, never accused, and never was upset with Kaikeyi, first. And second, when Kaikeyi's own son actually was cursing his mother for being so rude and wicked, he was the one who intervened and stopped Bharat, saying, not she's our mother, and not to say anything, because he understood the intent, what the great lady wanted. The great lady, it's been more than, I would say, more than thousands of years later, today, even today, the lady lives in this world, in the memories of everybody, as an evil queen. But it's time for us to know that, yes, the intent was so right in the benefit of the kingdom, in the benefit of the people. And there it went. So, that's the story of Kaikeyi, Rani Kaikeyi, because if we all know her as the evil queen, but many of us did not know the greatness, the intent, and the actual reason behind two very big decisions mentioned in the history, in that epic. That why did it happen, and what's the background for it? So. Here I end. So any comments about this? So has anybody actually could relate anything with the story? Any comments first? Let's just listen. Anybody?
So I think all of us were very engaged with the story you were saying. I could see everybody focusing on the screen, listening to you. And we got lost. We lost the purpose also, that why we are listening and what we are listening, but we got so, so it was good. Yeah.
So I actually wanted to say, so I've missed out on one thing. That was the topic why I wanted to, attend this thing. Probably I was too hassled. I'm sorry about it. And straight away went on that. So I missed my first slide. The first slide was actually to, to know your audience, to know your participants without judging. So that was the reason this was the best story I could pick up. And here, why I chose this story, because it was actually surprising for me that everything we knew about her was Kaikeyi was the evil queen. We never knew that she would be there is a great cause and there's a great reason behind it. So while I said this story, and I'm yet to explore any thoughts. So because I revealed the topic later, and which I've missed out in the beginning.
So Captain Sandhya, do we have more slides to see, or it's?
Yes. So we have. We have
this is okay,
so
yeah.
definition of storytelling on what it is actually. I have adopted it from the National Storytelling Network, US, because I find it a very good source of information. So it's an actually interactive art of using words and actions to reveal the elements and images of a story while encouraging the listener's imagination. So we help them with the words on imagining this scenario which we are describing. So, and we encourage them and expect that we convey the message. But there are a lot of advantages which I see when we talk, we narrate an incident, that there is cultural understanding. We get to know about, because when we learn the background and everything, we learn about the culture. There is, imagination, there is curiosity, and then listening. When people are listening, it actually improves their focus. It improves their listening skills, but also the social skills. Why I say this? Because it actually improves when people listen to it patiently. So apart from this, but it's not necessary. So on the other side, there are, as every scenario and every session cannot be starting or ending, or can be driven through storytelling. There are many disadvantages also, where it replaces the information with narrative. So the accuracy is likely to get compromised. It impedes the rational judgment, because it does the perception management of the audiences. Many times they stop thinking, because they are only listening, and they are perceiving, they're imagining because of the narration. More importantly, it is very vocabulary sensitive, because it's the way it is spoken, the words which are used to narrate. It slows down the communication, yes, and fine, because it is it is subjective many of times, so it serves as a weak evidence. And more importantly, while there's not much, but I would certainly like to share anybody using storytelling. So just to have in mind some do's and don'ts, 5 of them. So do have the passion for knowledge of the topic. So we need to work on and to be aware about what we are going to talk and relate the story to it, having it relevance with the with the topic, and creating something which is immersive, means which draws the attention and they feel involved and interested. And of course, it should carry your message, what we want to convey. And of course, do some research and study, and while talking about a particular story or a situation, narrating it to a certain set of audiences. Apart from this don'ts, yes, there are some things which we should avoid. So it shouldn't happen that we are selling and we are trying to convince people, and not to tell. It's like showing the story is, it's the way it is being narrated. Not to forget that there is an involvement, there is a team, there is an collaborators, or there's a group which is actually waiting, and importance of teamwork to be always kept at at the forefront. And do not keep over complicated. Just keeping it simple, means keeping it simple, and yes, making people smile, to have them more engaged and connected throughout the work. So that's about to avoid and to keep in mind. And this is all about storytelling. Thank you.
Thank you. So if you could, yeah, thank you. Thank you. So Captain Sandhya, thank you so much for wonderfully narrating this story. I think you gave a wonderful demo. How do you go about telling story with all the expressions and voice modulation and the excitement and the thought process that you evoked among all of us? I think it was a wonderful job that you have done on storytelling. So if anybody has a question to ask, please, because this is one of the pedagogies being used all across the world, and they have found it extremely, extremely engaging, especially even with the adult audience. We thought it's only fit for children, but that's not true. Even adults like to listen to stories, and especially if they don't know the end. So it really, creates a lot of curiosity and interest in the.
I would like everybody to critically evaluate.
I think, Madam, Captain Sandhya, we
Yes,
were at the fag end of this,
session.
our session, and you made it. You lit up enthusiasm now with your excellent story, and we are not knowing that the time has passed now beyond 9:15. So first, thank you for making a very excellent story. Though it was very crisp
Generally.
and only one incident, but it was very interesting. I know what point you are coming towards. That don't be, judgmental about,
Judgmental. Yes, sir.
about. I think that is one point that you are trying to raise, and I think that is a very important, thing. And we are always judging people too
Judging.
much. All
Yes.
the time we go on judging, day in and day out, and. And if you don't watch the television, if you don't read the newspaper, you have such a peace of mind because every day it's judgmental about this person, that person, and even in WhatsApp or otherwise, all this. So judgmental, not being judgmental helps in your professional work and in your
Personal life
in the
also.
communication, personal life also. I
Thank
think
you.
very good, very well brought out point.
Yeah.
Thank you.
Excellent.
Thank
Thank
you
you.
so
It
much.
was amazing. It was so good. You
Uh,
created a visual imagery. We were over there. It's like, we were experiencing, we are standing there, we are watching KK doing this. She's in the, it was really good. Very nice. I will try to copy you further and make my storytelling so effective so that people listen and say, wow, yeah, we actually felt. I mean, this is what matters. One should just get the feel of it. It was really good. Very nice. Very nice. So clap for you.
Thank you so much. Thank you.
Thank you for the wonderful job. I think both of you have done, Dr. Pinky and Dr. Sandhya. You've done an excellent job.
I missed
Thank you,
Dr.
Sandhya. Thank you. Wonderful. You were really nice story.
I missed yours today. And Dr. Indo, your points taken, it is really relevant. I felt at a moment that it was long.
So I think somewhere the audience should be able to understand the message. And if you could clearly conclude your story with the message that you want to give, probably like Dr. Pai could actually tell us exactly what you wanted to say. I mean, otherwise, I think it was a very well done job. And again, if you could keep it little short, then we could have had more discussion around it. And we could have even made them recall what are their understanding, what do's and don'ts of storytelling. So I don't think I would take further time. It's already very late for all of you. So I have shared the feedback form in the chat box. If you could quickly go to the chat box and complete your feedback form, and then we conclude the session. Okay, so good. Some of you have already done it.
Ma'am, did you get my message that tomorrow I have a CME happening at the hospital, so I have to do the hosting?
We are not meeting tomorrow. We are not meeting.
We are not meeting tomorrow. I forgot.
Yeah.
Okay, good.
We are not meeting tomorrow. Actually, as I said, my daughter has come back last week.
Yes, you did.
But I didn't want to cancel today's program. I said Friday session go on, and then from next Friday we can take a call whether we have it on Friday, Saturday, or we continue only Fridays. So today's session 6. We are left with 4 more sessions.
I think, ma'am, once a week I would prefer, unless everybody is agrees on that.
Yes.
Yeah,
I am okay anyways.
Yeah.
That is comfortable to all of you. If you're all comfortable, then we can keep only Friday. If that suits you. Only thing is, I think Dr. Leah has some change in the timings. I just need to check with her. Otherwise, we can.
Ma'am, sorry, I'm traveling actually whole week for next 8 days.
Okay.
So I'm not sure I'll be able to attend the next session.
Even the Friday.
I'll request for the video recording.
Yeah, definitely. I will be sharing.
I'll try my level best, ma'am, but I'll be transiting between 2 states. I'm visiting our hospitals only. So
sure.
Thank you.
Sure. So if all of you have done, if you could write done in the chat box, I would know how many of you have. I have received 4 yes. Let me check how many of you have replied. Yeah. So I have received 8 responses. Good to go. Right. Thank you so much. I think here we end the session with the wonderful beginning by two of you, Captain Sandhya and Dr. Pinky. So in the next session, I think Dr. Bala was saying that he will do the presentation, and any one of you can, message me directly and we can connect to discuss your pedagogy so that we know what needs to be covered in the presentation or discussion.
Yes, a prior discussion is very much required.
That helps. Yeah. So thank you so much, everyone. Bye-bye. Good night.
Bye.
Thank you, ma'am. Thank you.
Thank you so much.
Good night.